Hello everyone, welcome to Medimax Moments. Today we are going to talk about the tests that you need to do when you see your doctor for couples that want to be treated for infertility. Some of the tests being offered will include FSH, that's follicle stimulating hormone, AMH, anti-Mullerian hormone, prolactin tests, LH, luteinizing hormone, and progesterone test. For AMH is a test of ovarian reserve. For certain women, when the age is more than 35, especially, we want to test ovarian reserve by way of doing AMH. This guides the gynecologist in trying to see how we can best optimize her treatment by way of adjusting the dose and also in terms of increasing the dose of the medication as well, so that we can get as much quality and number of eggs as we can. It also may guide the gynecologist to either consider donor eggs, because if the AMH is not good, is bad, not optimal, then we may counsel the couple on the need for donor eggs. FSH is also a test for women to know whether they are ovulating. Everybody may ovulate, but the quality of ovulation is very, very important. The true test of ovulation is pregnancy. So if you may ovulate and not ovulate well enough for pregnancy to occur. So FSH helps in this regard to knowing how well you are doing. Also helps us to know how we can help the couple. Progesterone as well is a pregnancy hormone. The levels will determine how well prepared the woman is through this infertility journey. For prolactin, high levels of prolactin may suggest that there are problems with ovulation. Thankfully, there are medications that can be administered to reduce the prolactin level. With a reduced prolactin level, then it's time for treatment to commence. For male tests, seminal fluid analysis, that is sperm test, is the most common test done. It is very, very important for it to be done. In that test, we tend to ascertain the number, the motility, the morphology. I'm going to break it down. The number, that's the count. The motility, that's the swimming ability of the sperm cell. Morphology is the shape. Is it well shaped or abnormally shaped? All these count in deciding whether the male sperm is okay for it to be able to fertilize the egg. In certain situations where sperm parameters may be very bad, we may need to do some advanced tests by way of hormonal profile to know exactly what is responsible for the abnormal sperm parameters. But that will be a story for another day. The essence of the testing for the couple is only to know where the problems may be coming from and how the gynecologist will be able to help in this regard. In some situations, the man may be a problem. We call it male factor infertility. When it's a problem with the woman, it's called female factor infertility. In some cases too, both the man and the woman may need to be treated for us to achieve our goal. That will be all for today. Till next week, when we continue to address fertility concerns. Don't forget to subscribe. Turn on your post notification. We look forward to seeing you with a new video.